May I ask you a few questions?
Yes, thank you.
Please tell us about your experience here at Mayo. How has this experience, the care you received, the people you met, affected your life and the life of your family?
Well, quite simply, it's affected everything and my entire life. Without the care that I received at the clinic, I don't believe that I'd be here today, and my children wouldn't have a mother, my husband wouldn't have a wife. The prospect of the surgery alone gave us hope for the future, and the excellent care gave our entire family love and healing at that moment, and that ongoing education and follow-up care gives us continual support and hope for our future.
Okay, thanks very much. I'd like to ask also, one of the things that we talked about and still talk about was that taking care of you required the efforts of a team. And how did you feel about that team? Did you sense that there were many parts to your care and lots of people contributing? And please give us your thoughts about the teamwork.
Certainly, yes. We can recognize that there were dozens and dozens of people, and although you were your immediate team idea for my surgery, we recognized that it wouldn't have been so successful in me if it wasn't for that team and for every individual. It seems to me that it's the small things that I remember from my care. I remember, Dr. Yarzemski, your gargantuan hands holding mine as I drifted off to sleep like you promised my husband. And I remember the plastics team coming in very early every morning and me begging them to let the nurses take the staples out because I was convinced that the nurses would have more time and they would go more gentle. And one of those very early morning visits when they said, yes, indeed, we could do that. And the guidance that we received from a child psychologist on how to deal with this with our children and how to talk to them about it. That our care, my care wasn't just my care, but it was for my entire family. I don't think anybody was missed, and I don't think anything was missed. And the regular visits from the IV team and the pain control team, the physiatrist, even the pastor were always welcome visits because everybody was so professional and so caring.
Great. Thank you very much. One last question, if I might. Many of the people who took care of you are here in the audience at the several sites around the campus where this is being shown. And this is an opportunity, if you'd like to take it, to talk to anybody and everybody who participated in your care. Please go ahead and speak to them.
Thank you. Well, of course, the first thing I want to say is thank you. Thank you to everybody who participated in my care. I realized that it was an incredibly risky procedure on my part, but I was put at ease by the team and by the confidence that I had. Dr. Yarzemski, you are a household name for us to the point that the other day I was going to get some of my meds and I asked my husband what my doctor's name is, meaning my local one, and he told me Dr. Risk, and my 3-year-old son said, no, it's Dr. Yarzemski. But we realized that it wasn't just you, that there was a huge team behind you that included dozens and dozens of people. And we are so proud to be the first to have this surgery and to have it go so well. And we know that this surgery is going to save countless lives, as it is right now for one of my fellow Canadians. And although the surgery itself is a huge thing, we'd like everybody to keep in mind that it's often the small things that you do that mean the world to your patients. And I'm sorry, I didn't catch the lady's name that spoke right before you, but when she was speaking about stories that mean the most, when I was putting a few words together, that's exactly what comes to mind for me. Like Dr. Yarzemski, the gift that your family gave to mine when I woke up from surgery. For the nurses, the extra popsicle they'd get me in the middle of the night because they indeed did get me addicted to them. And the plastics team letting me sleep because they came so early in the morning and I hated to wake up. They just kind of roll me to the side, see what they needed to see, and roll me back and leave me be and continue on. And the kitchen staff letting me know which one of those horrible protein shakes was the most palatable. It's not only the huge details that set the Mayo Clinic apart, but it's in all those small details. And I will never forget the care, and it truly was care that I received from the Mayo Clinic, and I will forever be in your debt.
Okay, thank you very much. What I'd like to ask now of those in the audience who took part in her care, please stand up at all the three sites. Anyone who's taken part in Janis's care, please stand for her now so that she can understand. And what I'm going to do is just read a list of the people that took care of her and the other spino-sacral pelvic sarcoma patients that we take care of in a team manner here at Mayo. This includes the surgeons, orthopedic surgeons, neurosurgeons, our anesthesiology colleagues, both those that keep the patient alive in the operating room and then those that keep her alive in the intensive care unit afterwards, and the teamwork that happens with the staff anesthesiologist in the unit coming to the operating room during the day to get an update on the patient so that she or he knows that patient when they enter the unit in the evening. The plastic surgeons, the vascular surgeons, the general surgeons, thoracic surgeons, our nursing colleagues, our surgical services colleagues, the technologists, our pharmacy colleagues who keep the meds coming, our blood bank colleagues who keep the blood coming during the day, our medical oncologists, our pain service doctors, our physiatrists, pediatric surgery, our gait analysis laboratory who takes care of these people afterwards, and I'll say an additional thing about that in a moment. Radiology colleagues who help us determine the extent of these tumors to plan the surgery, and our pathology colleagues who we depend upon to let us know what it is that the patient has. We also have radiation oncology colleagues, urology, GYN oncology, and colon rectal surgeons. As you can see, it's an enormous team that comes together to take care of these patients. I'll make a comment about two other things before we close. That teamwork extends to our colleagues in the laboratory. I mentioned the gait analysis lab, but our colleagues over in the Stabile and the anatomy lab that allowed us to come and try to figure out how to take care of her when she came, and allowed us to work on the cadavers and work out this procedure before we actually did it on her. And also, when she had her gait analysis, you saw her walk down the aisle with her husband in her wedding dress. That effort began when Dr. Kaufman saw her in the gait analysis laboratory and said that a meeting of the Prosthetist and Orthotist Society was going to happen here in Mayo. And I asked Mrs. Ollson, would you mind if I present you to these people? I mean, we'll show the pictures of your surgery if you're okay with that. And she came down and we gave a presentation, and I told the prosthetists and orthotists that although there are hemipelvectomy prostheses, we took quite a bit more from her than the usual hemipelvectomy, and it was difficult trying to fit her with a prosthesis, i.e. Had not yet been accomplished. And Janis kindly came with me to the meeting and sat in her wheelchair next to the podium as I presented her case. And when I asked for questions from the audience pretty much got up and ignored me and went over and started talking to her, and I figured they got it. The teamwork includes industry. Industry had a great deal to do with this. Our industry colleagues that were at that meeting took her on and went through planning and made that prosthesis that allowed her to walk with just a cane that she's also done up in our department when she's come for follow-up. So teamwork makes this happen. I thank all of you for taking care of her and the countless other patients that you work together to help day by day. And Janis, you've become a spokesperson for people who have serious cancers like yours. We thank you for allowing us to come into your life and tell us all about you, and please keep it up, and thanks again for coming here this morning.
And thank you for having me.